A new report shows that smoking is increasingly becoming a habit of the poor and of the working class. I was recently in Paris, and I always note when I'm in Europe how much more people smoke than in the United States. In Paris, certainly noticeable. In Italy, it was way more noticeable even than in Paris. And there's a New York Times article which is making some interesting assessments about a new study related to smoking. And it points out that when smoking was first popularized in the US in the early 20th century, it was really something that richer people did. Cigarettes were kind of like a high society symbol of elegance, of class. Doctors smoked cigarettes, movie stars, etc. And over time, we've learned more and more about how deadly smoking is and how bad of an idea it is for your health to be smoking, and also how expensive it is if you think about how much you're spending on cigarettes over the course of a month or a year. And that has actually brought down smoking rates in the United States, and it is a good thing. I don't think anybody could argue that it's not. And the previous data found that the national smoking rate has continued to decline, but that there's a geographic divide, right? That if you look at the affluent suburbs of Washington, for example, about 10% of the population smokes, whereas if you look at Clay County, a poor part of eastern Kentucky, about 40% of the population smokes. By the way, residents there far less likely to be able to afford cigarettes without it having a negative impact on their overall budget. The new study finds that affluent counties across the entire country have experienced the biggest declines in smoking rates, and that those declines have been basically non-existent in poorer areas. About 4% of poor counties see declines in smoking rates, while 50% of rich counties show declines in smoking rates. And there's two impacts here. The obvious one is that if you have this increased gap in the smoking rates between the rich and the poor, you're going to have the rich and the poor health gap be even bigger. That just makes sense. But it's going to exacerbate the income inequality as well. Because when you think about the rich not spending money on smoking and the poor spending money on smoking, that furthers the income gap, all else being equal. And in addition, who makes money from people smoking? Big corporations and their rich executives. So really, on three different levels, smoking has now become another factor in growth of inequality in our country between rich and poor.
Right. And thinking about it worldwide, working in downtown Austin, uh, it's funny. All the homeless people, Austin has a lot of homeless people. Honestly, I think they all smoke. And at South by Southwest, seeing all these Europeans here, they all smoked as well. And I don't know. It's a sad state of affairs.
If I recall correctly, Poland has one of the highest smoking rates in Europe. I think I read that recently.